Now let's talk about parathyroid hormone. PTH has hormone receptors on the osteoblast. They will go and stimulate the osteoblast, which in turn will release the rank ligand. Question number 1. PTH receptors are present on osteoblast. Question number 2. Rank ligand is released by which cell? Osteoblast. This rank ligand will go and attach to the rank receptor on the osteoclast and will stimulate it to cause remodeling. Remodeling means a balance of resorption and formation of bone, to renovate the bone, to reform the bone, to preserve the quality of the bone, maintain the homeostasis of the bone. But if there is excessive PTH levels, very high, this is called as hyperparathyroidism, causes PTH adenoma. They will usually give you a young female in it. They will give you, patient will have abdominal groans, abdominal pain. Patient will have psychic moans, irritable behavior, renal stones, stones in the kidney, and bones. What in the bones? So, high PTH stimulates a lot of osteoblast, which in turn stimulates a lot of rank ligand, which stimulates the rank receptor and then the osteoclast. These osteoclasts will cause more lysis. So the bones will become hollow. This is called as cystica, means cyst in the bone. Cyst is filled with fibrous tissue called as fibrosa cystica. There is bone which is getting involved, osteitis, fibrosa cystica. When there is blood in it, the blood degradation products gives it a brown color called as brown tumor. This is the story of hyperparathyroidism. But then this cycle can be utilized for the treatment of bone softening disorder called as osteoporosis. How? Now, if you have drugs inhibiting the osteoclast, you can prevent the resorption. 2 drugs which do that: bisphosphonates and calcitonin. They inhibit the osteoclast. In fact, bisphosphonate is very potent. That's why it's called as a drug of choice for osteoporosis. Problem: every rose has a thorn. Bisphosphonates also will inhibit the remodeling cycle, and over years, many years, it has high chance of causing the fractures, the proximal hip fractures. This is a rare side effect. That is why bisphosphonates have been labeled as drug of choice for osteoporosis. The other level where the drugs can act, estrogen. It can inhibit the rank ligand. One more drug, denosumab, which is given subcutaneous, 6 monthly dose, inhibits the rank ligand. So these are the 2 areas where you can inhibit the resorption of the bone, rank ligand or osteoclast. But then you can give low dose mind you, PTH, which will only stimulate the osteoblast, will not release the rank ligand. This low dose is how much? 20 micrograms per day. How? Subcutaneous. This is stimulating the bone formation cycle. But then you have a drug which acts on both, called as strontium. Strontium inhibits the bone resorption, stimulates the formation. But because of the cardiac side effect, it is not a preferred drug. And it's also not as potent as our favorite bisphosphonates. This is what you should remember about parathyroid cycle.